Yes.
Somebody shout out to me. Okay, thank you, thank you. So this is cool. So this is like to me, this is very neat. This is a card that I did not write, that no one wrote, that we use kind of Anki, ChatGPT add-on that we created to convert closed cards from the On King deck. I need to give a shout out to the On King deck because we did not produce this image, but effectively, this card was generated and has a corresponding On King card. And so if you edit this card, you can see there's an MCQ kind of button, and you can press it. It'll bring up in the browser the corresponding On King card that was a closed card. So this was a card that had ID, bony opening. It has the cranium, the basal part of the cranium, and then it has the foramen ovale is the closed section correspondent to the image as it's marked. It doesn't have to be as simple as this card. It can be something that like is more advanced because the AI actually picks out what's important and decides what to put into the multiple choice card. So we'll talk about why that's really useful and why we do that throughout the kind of meeting. But I'm just gonna like flip through these and we'll like talk about what we think the answer is. I definitely encourage you guys to just like nobody's keeping track. Nobody's gonna see on screen who you are and who's saying what. So these are gonna be like rapid fire, like spit fire really fast. So I would suggest just like yelling out the answer, or you can say it in the chat and you guys can have discussions there. I'll open the chat so you guys can like write in your answers. But we're gonna be looking at them here and just like going really quickly because I have the remote and I'm just gonna be navigating using that. These are not going to be as slow as the vignette style questions, and you won't be on the spot, so it'll be a little more fun. So, does anybody know have a intuition as to what runs through this opening, and maybe what this opening is the foramen ovale? They give you that, but do you guys know what runs through the foramen ovale? V3. All right. So V3 I think that's a good, yeah. So that's a good start. So like V3 is the third branch of the trigeminal, right? And then we have the facial nerve, which is another cranial nerve that runs, through one of these openings, but it's not the foramen ovale. So so you're right. Let's. The more votes we get for the answer, that's the choice I'm going to choose, and then we'll talk about it. If you guys want to ask some questions or fill in the details, we can do that as well. No idea. Great. Yeah. So if you don't know, let me know too, because I'm also thinking about adding an option where you can press a button and say I don't know, so that because one of the things that's going on, guys, is I'm sorting my Anki cards that aren't multiple choice. So that's another thing I should mention. If I choose V3, it will actually have the option of suspending this card, corresponding Anki card, and wind up. I won't have to study that material because I got it right? So it'll cut down my 33,000 cards into something more manageable. So the things that I get right in multiple choice, I actually won't study on Anki first. I'll study all the things I got wrong on multiple choice. If you get something wrong on multiple choice, you're very unlikely to know that material as strongly as you should on test day. And so that's the idea. What neurotransmitter is described in production in narcolepsy type 1? Is decreased in production in narcolepsy type 1. What do you guys think? Hypocretin, yeah. Hypocretin, yeah. So orexin. One of the things about orexin is it's not just about appetite, right? It's about how vigilant you are and how cognitively alert you are, right? So that's a good guess. I don't know if that's a guess. You might know. So let's try that. So I'm gonna click 3. Here we go. Hypocretin. So it just suspended. You can see how it says process correct MCQ note in the bottom left. So triptan, that was a good one. So we got that. So triptans are known to trigger which condition? Yeah, Cynthia got there. She's got 2 right in a row here. Triptans are known to trigger which condition? We're still admitting people, so people are jumping in here. So triptans are known to trigger. So I want to say vasospastic angina. I haven't seen these before. These are random USMLE first aid RX on King tagged questions. So I think it's vasoactive angina, but I could be wrong. Yeah. So it's angina. That's Prince metal angina. Yeah. Yeah. So Kaio, I hope I'm saying that correctly. Got that right. So Cynthia vera may cause polycythemia vera may cause proliferation of RBCs, platelets, and which of the following? Monocytes, granulocytes, lymphocytes, and megakaryocytes. So what do you guys think? Proliferation of what in addition to RBCs and platelets? I think it's yeah. What are you saying, Larissa? Oh, maybe she. Yeah. So maybe the mic's just on. Megakaryocytes, I think maybe. I'm not sure. So I think it's megakaryocytes because what are megakaryocytes going to become? They're going to become platelets. So it's kind of um, sometimes the ChatGPT generates cards. Right now, we're still working on it. The next generation of ChatGPT will make our software better each time it gets better because it'll be more intelligent. Sometimes it writes answer choices where there's multiple correct answers. So it's a drag, but the whole point is to have this is a point about USMLE concerning screening tests, right? When you do a screening test, you want it to be you never want to have a false negative. You want to have all of the false positives need to be included in a screening test so you can rule out the possibility that you have cancer or something. So you want to have it's okay to include false positives, but you don't want to include false negatives. So that's what this is doing. If we have a negative, if we have an incorrect multiple choice, it's supposed to be something you really don't know, and it's okay to get it right for illegitimate reasons. In disseminated intravascular coagulation (DIC), what happens to PTT, partial thromboplastin? Yeah, Cynthia. I was thinking the same thing, Cynthia. It might be actually be true. I think it is. Disseminated intravascular coagulation (DIC). What happens to PTT? PTT increases. Yeah. All right. All right. I love that we have participation. It's so much better. Craniopharyngioma typically presents in which age group? Infant or child is kind of the. What do you guys think? Child. Yeah. 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 All right. Let's try it. Nice. 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 So inf is up to 1 year, right? So pilocytic astrocytomas are most often found in the posterior fossa, such as the blank. Maybe, yeah, Leslie, you got it. I think we have a little bit of delay, but cerebellum. All right. Cerebellum is where the pilocytic astrocytoma. That's absolutely right. What will you see on biopsy? Do you guys know? I'm just going to add something. If we biopsy the pilocytic astrocytoma, what would we see on histology? It's an eponymous name. We would see Rosenthal fibers. And this is one of the supratentorial. Yeah, yeah, yeah. So this is one of the infratentorial. Sorry, medulloblastoma, pilocytic astrocytoma. You can get a brainstem glioma, and you get a craniopharyngioma. I mean, infratentorial ependymoma. Excuse me. Craniopharyngioma is supratentorial, along with astrocytoma, and so yeah, cerebellum is absolutely right, Carol and Cynthia. We got there. Yeah, so they're showing that image, and you can stop. This is sending a bunch. By the way, it's sending all the cards that are wrong that are multiple choice into its own deck, and you can review them with spaced repetition without having this quick like not getting to see the explanations below. It'll show you the explanations below when you go to the wrong answered multiple choice deck later, and so you'll get to review them just like you would with Anki really quickly. And it is quick. If you have a remote and you're by yourself, you're going to go quickly. What is the effect of polycythemia on blood viscosity? So if you have more red blood cells, platelets, and granulocytes and megakaryocytes, what's gonna happen to your viscosity? Exactly, exactly. And you have clotting. That's why you have stroke risk, acute mesenteric ischemia, and stroke. And what sensations are lost in syringomyelia? So what they're saying is what kind of syndrome is it going to be? Anterior cord syndrome, posterior cord syndrome, central cord syndrome, pain and temperature. Yeah. So why would it be? Why are we thinking pain and temperature as well? Is it central cord syndrome, anterior, posterior? So syringomyelia is central cord. Sometimes you get this from like whiplash when you have spondylotic changes in your spine, which is basically osteomyelitis of the spine. So pain and temperature is absolutely right. That's great. Cynthia's killing it right now. Initial presentation of uh, Naegleria fowleri. I probably say that wrong. Protozoal infection consists of alterations in taste or smells with headache, stiff, blank and altered mental status. So stiff what? Shoulder, neck, back, leg, neck, right? Yeah. So that's like that's like meningismus, right? Kind of inflammation of the meninges. Unfortunately, this like admission notifications right my way. What age related conditions can improve mild myopia? Do you guys know what myopia is? Which, I know you know that it's one of the two, but do you know whether it's nearsighted or farsighted? Yes. Okay. Okay. So, yeah. So myopia. Yeah. So presbyopia. You think? Okay. Presbyopia. Presbyopia is when you get older and your eyesight, your accommodation and your. Okay. So what does the M in the mnemonic hamartoma for tuberous sclerosis stand for when referring to development? So it kind of gives it away. We're going to have an enhancement app where you can make all of the answer choices exactly formatted the same way. So it is hard, actually. Hamartoma is a really good mnemonic for this disorder, though, because this disorder comes up quite a bit. And once you know hamartomas, I would really emphasize also when you learn hamartomas, the mnemonic for tuberous sclerosis, that you remember where the angiomyolipomas are going to actually present in the patient. Is it going to be its involvement of the eye or the kidney? What are we talking about? Because it will distinguish it from von Hippel-Lindau and some of the other things that are really similar to it. But the answer is A. Yeah, mental. Yeah, exactly. You guys all got it right. Um, Patients with labor hereditary audit. Sorry, I'm nervous. Labor hereditary optic neuropathy develops a subacute bilateral and progressive loss of what is it? LHON. What are you thinking? This is really, really lesser known. This is not a very well known. I think I could be. Yeah, this is tricky. So I got central vision. I guess I got it right. Yeah, that one. I suggest you look that up. That I didn't know that either. Contralateral homonymous superior quadrantopia is a visual deficit associated with lesions of which lobe? So we're talking about visual, right? You guys probably know this. But I really want you to look, I want you to think about what does it mean to be quadrantopia? Exactly, Leslie. Yes. So I said occipital and it was, oops. So I have a button here that I can go backwards. I can go back and it'll actually resort the question back to the deck that it should be until you answer it in the way that you'd like. So if you hit the wrong button, you can go back. So the answer it says is temporal if you're going to have quadrantopia, as opposed to if it were in the calcarine sulcus of the visual cortex, you might actually have um, you might have macular sparing and just have a global. So I overlooked that. So we got that wrong. So that means that that card, when we browse this deck, is actually going to show um, a unsuspended card, right? Cocaine intoxication can cause agitation, and which of the following changes in pupil size? Yes. Yeah. So it's going to be sympathetic activity, right? Yeah. Exactly. What is a dose-dependent hematological complication of chloramphenicol use? This is a good one. Yeah. Aplastic anemia. Exactly. So you can get gray baby syndrome. Which malabsorption syndrome is associated with PAS positive foamy macrophages? PAS positive. Yeah, Whipple. Yeah, that's classic, right? And you'll see what that means on the card when you if you get that wrong. Hamartoma, the A in hamartoma could be angiofibroma, could be ashleaf, right? Because they're both present in tuberous sclerosis. So this is a kind of a situation where you might get it wrong and have to review it anyway. But it's still cutting your cards down, and you get to see some content. But I think it's ashleaf on this one. No, it's angiofibroma. Okay, so they're both A's, but they're both present to be sure. What is the most common primary CNS tumor in children? This is a good one to know. You guys know? Pilocytic. I think, yeah, for children, that's correct. Yeah. For adults, it'd be glio, right? Yeah, exactly, Daniel. Exactly. So pemphigus vulgaris is due to IgG antibodies against what? Desmoglein. Yeah, yeah. So those are desmosomes, and then hemidesmosomes would be what disorder? Do you guys know? What would be the hemidesmosomes? It'd be bullous pemphigoid, right? You guys are typing it in, I know. What is the complication of GAS pharyngitis or skin infection that presents with hematuria? I just want to distinguish those two disorders. So, bullous pemphigoid, you're going to have tense bullae, right? And you're going to have, it's going to be itchy. Pemphigus vulgaris is painful and it's going to affect the mucosa, which means it happens in the mouth, which is very important on step one to distinguish the two. So, and the reason that you have tense bullae in bullous pemphigoid is because when it affects the hemidesmosomes, they're at the bottom. So that's what causes it to be a bullae that is high in, it's going to be raised from the skin, but it's not going to be easily poppable. The desmosomes actually connect the keratinocytes on the sides, which allows them to pop, right? They're not holding together as well as they would otherwise. So that's autoimmune disorders. What is a complication of GAS pharyngitis or skin infection that presents with hematuria, cola-colored urine, and facial swelling? Yeah, rheumatic fever, right? Yeah, so rheumatic fever or skin infection. So a skin infection actually can't cause rheumatic fever. That's one of those things. So this is a really nice point. The I in impetigo is just like, it reminds me of the number one, and it only has one thing that it can lead to: post-streptococcal glomerulonephritis. Pharyngitis and impetigo can lead to post-streptococcal glomerulonephritis, but only pharyngitis can lead to rheumatic fever. Do you guys? Yeah. So that's a nuance that is like, they it's just a detail they love to go into. Along with bats, rabies virus is also commonly carried by. Uh, so what also carries rabies, guys? Foxes. Okay, got it right. You guys are killing it. You guys are absolutely killing it. So what? I'm just gonna give you like some like what carries leprosy. Do you guys know? This is like fun with English, because knowing all the animals and what they're called in English must be a treat. Tattoo. I think you're right. I think, but I don't know what a tattoo is in English. But is that an armadillo?
Yes.
Yes, that's okay. So Daniel knows. Okay, so armadillos have leprosy. So and they actually are kind of violent. I lived in Louisiana. They don't like humans. Muscles weakened in Erb's palsy may be remembered with the mnemonic "birds eating herbs." What does the S in birds stand for? So you don't have to know the mnemonic. You can just say what thing supraspinatus, right? For Erb's palsy, supraspinatus. Let's try it. All right. Nice, nice, nice. So Erb's palsy, as compared to you have Duchenne and you have Erb's, right? Erb's Duchenne and you have Waiter's tip, right? Um, yeah, yeah. So fluent. So Wernicke's aphasia is characterized by blank speech. So you're gonna have, is this productive aphasia or is this conductive aphasia or is this um, aphasia of production of language? So yeah, so it's fluent. Let me see, fluent. So this I have a really nice way to learn that, by the way, and I'll send it in the WhatsApp group because it's too good. Epstein anomaly is associated with which condition that can lead to arrhythmias? Um, do you guys know what Epstein anomaly is? I don't believe that, Cynthia. I think you're killing it. Oh, she's a radiologist. Oh, well, I mean, that doesn't hurt, right? Epstein anomaly is associated with which condition that can lead to arrhythmias? Um, so, Epstein anomaly. Are you guys aware of this one? Long QT, right? No, it's Wolf-Parkinson White. Sorry, what am I saying? Delta wave, right? So, Epstein anomaly is going to be uh, you need to know ECG findings and kind of understand the pathway, which this rapid fire I can't really teach this way. But most loop diuretics are blank drugs and thus may cause adverse reactions in allergic patients. Yeah, they're a sulfa drug. So furosemide actually is a sulfa drug, so you can have sulfa allergies to that. Exactly, Daniel. Everybody. Great, great. So what type of white blood cell is elevated in eosinophilic granulomatosis with polyangiitis? This is kind of similar to other atopic. I mean, obviously eosinophils. Maybe that's the answer. See, sometimes it writes overly simple, obvious questions, and that's certainly one of the conditions of having ChatGPT be where it is right now, but it'll improve. One complication of severe prolonged beta 1 thiamine deficiency is blank syndrome. Yeah, Wernicke-Korsakoff and Berry, technically, right? So they're both true. So we'll see what they say. Yeah. So bilateral lesions of the amygdala and thus Kluver-Bucy syndrome are associated with which type of encephalitis? Do you guys know? I have this typed in my chat, so I'll answer it. Yeah. Yeah, Cynthia, exactly. HSV1. P53 restricts the cell cycle to G1 by leading to the inhibition of blank, maintaining the hypophorylated state of RB. Here we go. Can we do it? Is this the question that will stump everyone? This is a hard one, actually. So, CKD6. All right, all right. So this is on that one of the sketchy micro because it pertains to HPV virus. So it's actually CDK. Yeah. Okay, 6. So CDK. Let me see here. CDK4. Yeah. Okay. So let's get that wrong so I can see that again. Which of the following is a known trigger for vasospastic angina? We already know this, right? We already did this one. Exactly, triptans. Nice, Leslie. So the blank reflex tests nerve roots C6, C7, and C8. Exactly, Daniel. Yeah, I know there's a delay. I know you guys are typing it in the real time, so appreciate you hanging in there. The blank reflex test nerve C6, C7, C8. So I have a really good mnemonic for this too and picture that I draw for this. So I'll send it to the chat as well. Triceps, right? Because this is C7, C8. If it was C5, C6, what would it be? It'd be biceps, right? Exactly. So Broca's aphasia is characterized by what comprehension? Exactly, exactly. Broca's aphasia. Yeah. What are we doing? Characterized by blank comprehension. Um, so Broca's aphasia is characterized by blank comprehension. Impaired, intact. Okay. Yeah, you're still able to understand what people are saying. It's just when you speak, you're incomprehensible, right? So that's great, Daniel. So is it Danielle or Daniel? I'm sorry, I might be saying it completely wrong. Excuse me. Mutations in MYCN may cause blank due to a resultant amplification of transcription factors activity. So this is neural crest cell migration. So I think it's melanoma actually, right? Ah, it's neuroblastoma. Okay, okay. Leslie killed it. I think. Oh, it's Mick. Mick is melanoma, right? Yeah, Leslie got that one. There we go. So, what diagnostic tests are run to test for giardia? This is actually a very high yield one. They will ask it in this way. The phrasing of the question will be this way. Yeah, PCR, exactly. That's one of those things. ELISA's a fast study for protein. What other thing is a study for protein, but it's not as fast? Is Western blot, right? Do you guys know the mnemonic snowdrop, where Southern blot is used for uh, um, DNA Northern blot is used for RNA, so snowdrop. Um, and then blank is characterized by a triad of symptoms that can be remembered with the mnemonic Cannabeer. So you guys know this one, I think. Cannabeer is confusion, ataxia, nystagmus, and ophthalmoplegia. And B is for B1. So you already know this. This is Wernicke's aphasia. Yeah, exactly. Samsung got it. I'm going to call you Samsung, but okay. Korsakoff. Okay. Fat embolism. I know you have a name. You can tell me your name and I'll call you that. Fat embolus is associated with bone fractures, particularly blank bones and soft tissue trauma. Um, yeah, long bones, right? So that's usually the femur and the pelvic bones. Um, and that's classic. You see a femur or pelvic bone, you should actually start thinking fat embolism, even though I mean, you might do that in your practice even. It's considerable, but for USMLE they love it. Factor five, you're saying, what is the most common inherited? That's absolutely right. So, but the other thing is the penetrance of factor five is not that great. So people will have factor five, and they won't be expressing a coagulopathy, but they'll have it. It's very common. So, which pharyngeal arches give rise to the arch arytenoid, cricoid, corniculate, cuneiform, thyroid cartilages? This is pertinent to what disorder do you guys think? Yeah. Yeah, this is a tricky one. I mean, but these pharyngeal arches come up usually when you're talking about ductus arteriosus and the carotids because they correspond to the vasculature, right? Of the developing, after gastrulation, you have this mnemonic for those. Yeah, this is a serious image as well. I think this is a first aid image. Let's try it. I think the third arch actually is a little bit higher up. So we could try it. Let's try third. I think it's fourth and sixth. Yeah, third. Third corresponds. That's like the most important pharyngeal arch when it comes to the aortic, like the primordial aortic vessels, because that will correspond to your carotids, I believe. Subclavian steal syndrome typically occurs due to hemodynamically significant stenosis of the subclavian artery, proximal to the origin of which artery? Yeah, it's six exactly. Yeah, aortic. All right. Subclavian artery, proximal to the origin of which artery? Vertebral. Okay, so let's look at that for a second. Subclavian steal syndrome. Yeah, so subclavian steal has to do with the diversion of blood that would otherwise go to the cerebellum and is then going back down up the vertebral vessels and then back down the vertebral vessels, and it causes you to have ataxia and kind of like cerebellar type symptoms. Yeah, so vertebral was yeah. So we went aortic, but that's going to be that's one of those things that they really like to harp on because they like to teach you that so you can understand carotid coronary steal syndrome, so you can understand that when you give diuretics like nitric oxide, you cause coronary steal syndrome, and it winds up actually causing the parts of your heart that were ischemic to become more ischemic because you're actually getting less. They're already dilated. So you're dilating the blood vessels that are stealing blood away from the vessels that are already dilated. So it's not quite the same steal mechanism, but they like to harp on how the stealing happens in those two disorders to explain the physiology of the caliber of the vessels and the vascular tone. Zollinger-Ellison syndrome is characterized by acid hypersecretion causing recurrent ulcers in the blank and jejunum. Exactly. Duodenum, right? Yeah, exactly. Yeah, so that's the first thing you do: a gastrin test, and then you would do a secretin test as confirmation. That's more step two. What effect does atrial septal defect have on S2 splitting? Yeah, it's fixed. What do you mean by fixed? What do we mean by a wide fixed split? What are you doing to test whether it's a fixed split or not? I know you know it. I'm just asking in this way so I can be exactly with respiration. So when you inhale, you decrease intrathoracic pressure, which causes less pressure on your vena cava, right? And if you less pressure on your vena cava, then you're going to have increased venous return. Increased blood to the right ventricular outflow tract, to the pulmonary artery, and you're going to have you should have more blood coming in and higher heart rate, and you should be seeing an S2 split that is changing. It's called heart rate variability, changing with inspiration and expiration. But you don't with atrial septal defect. Why? Because when the intrathoracic pressure goes down and the venous return goes up, the blood is just traveling between the two atria and equilibrating, and that equilibration of pressure um, causes the S2 not to split. It's normal to split, and this is actually a wide S2 splitting that is fixed, as opposed to varying with heart rate and breathing. So wide fixed split. Great job, Cynthia's killing it. People are giving you props today. That's great. um, I like it. I like that you guys are answering, and I love that you guys are supporting each other. So how does gastrin secretion change with Zollinger-Ellison syndrome? Um, yeah. So is it significantly increase? Probably. Yeah. Exactly. Exactly. What is the breakdown product of? Exactly. Yes. So breakdown of normetanephrine, which is the Latin is norepinephrine. The Greek is epinephrine is noradrenaline. Metanephrine from epi. Yeah. So what's going to happen? What is the breakdown product? Yeah, exactly. That's going to be in the urine, right? So you will see, yeah. So 5-HT is actually serotonin. So that's going to be your carcinoid syndrome. So you're going to see catecholamines and metanephrines in the urine. Um, and one of the cool things about carcinoid syndrome is its location determines whether you're going to see that in the blood. Because if you ACE is actually an enzyme that does a lot of things. It's actually the binding location for COVID, ACE2 receptors. But ACE is an enzyme that converts angiotensinogen, but it also will metabolize serotonin. And so if you have a metastasis to the liver that bypasses the liver, you can get serotonin that goes to the right heart and causes right heart failure. But if you have carcinoid syndrome of the lung that is going to the lung before it goes to your systemic vasculature, you actually won't see the serotonin because it'll get metabolized by ACE in your lungs. So ACE is actually in your lungs. It's an enzyme that metabolizes some of the products of the renin angiotensin aldosterone pathway. So that's kind of a cool story. I just thought I'd tell you. Lesions in cranial nerve blank results in loss of the motor limb of the light reflex. What is the motor limb of the light reflex carried by? Oculomotor? Okay. What drug class does ethacrynic acid belong to? Okay. Loops, right? Yeah. Cynthia, we are not able to, we need to stump Cynthia somehow. We need to find a good. So, which anti epileptic drug is associated with blood dyscrasias? No, I'm just kidding. Get them right. I want you all to get them right. That sounds good. Anti epileptic drug associated with blood dyscrasias. Phenytoin. Okay. Yeah, blood dyscrasias. What do we mean by blood dyscrasias? Like amyloidosis, primary amyloidosis is going to be caused by clonal B cells from blood dyscrasias caused by multiple myeloma. So you have dyscrasias production of abnormal lymph cells and blood cells. But so we're saying phenytoin here, carbamazepine. So phenytoin will cause Stephen Johnson syndrome. It'll cause hyperplasia of your gums. Um, and carbamazepine will cause agranulocytosis. Um, so imaging of blank reveals cystic lesions with mural nodule, most commonly in the cerebellum. Yeah, exactly. And that's when you see that, that'll be striking photo, the hyperplasia of the gums. Um, Imaging of blank reveals cystic lesion of the mural node, most commonly in the cerebellum. Ilocytic. Okay. Okay. Yeah. Yeah. So I mean, it's in the name, right? Yeah. Yeah. Exactly. Exactly. Which enzyme is inhibited or deficient in thrombotic thrombocytopenic purpura? Yeah. Atom TS. Yeah. So what happens is with Atom TS, you have um, Atom TS13 ordinarily would break up these giant megakaryocytes and large platelets. But without it, you'll have these like kind of super platelets that wind up binding one another and causing hypercoagulation. So without Atom TS, you have TTP when you're deficient. That's my favorite enzyme, though. Just kidding. What movement related symptoms are associated with Huntington's disease? Um, so I think this is athetosis, right? What do we think? What is athetosis? Do we know? Somebody want to write in? Yeah, we can look at that later. Do you guys want to look at the edited card and just look at athetosis real quick? That's one of the things you can do. You can hit the select, go back and look at this. This is athetosis, you guys. So now you answer it the same way. So you got chorea and athetosis. Chorea looks more like dancing. In fact, chorea means dancing in Greek. Macula is spared during posterior cerebral artery infarct due to collateral circulation with the blank artery. So we talked about macular sparing. We talked about the calcarine sulcus of the visual cortex. Dystonia, exactly, or athetosis. You get chorea as well. And your Montreal will be below 24, I believe. Basilar A, I think. A, all right. Basilar. So basilar, if you have an infarct of the basilar, you're gonna die. You will not be alive very long. Middle cerebral. So middle cerebral artery, the MCA leads up to, yeah, yeah. So the basilar artery stroke. In fact, I have a story where a neurosurgeon in New Orleans told me where one of his colleagues gave him a CT to look at, and he immediately said, "You need to send this person to the OR. This person's in trouble. This person has a basilar artery infarct and a narrowing from a thrombus." And the surgeon walked out of the room. Knocked a chair down and was very upset, and he didn't understand why. And he learned later that the CT was of his own CT. So blank is a curved bacteria that can precede Guillain-Barré syndrome. Um, Precede a Guillain-Barré syndrome. Yeah, so you're absolutely right. I know you guys know that. That's a good one. Yeah, you guys are killing it. Yeah, Campylobacter. This is like that's a poster child for sure. What is the condition described? It can other things can cause it though. Influenza can cause it. Lots of things can cause it, but Guillain-Barré is the poster child. What is the condition described as a small vessel vasculitis that commonly presents with asymmetric multifocal neuropathy? Asymmetric, small vessel. Those are big important words there, and then multifocal neuropathy. Yeah, what are you guys thinking? Kawasaki. Dude, if all things being equal, always if you don't know what the vasculitis is, choose Kawasaki, right? Henoch Schondlin in a child, posterior purpura palpable. Is it small vessel? Yes. All right, so let's try Kawasaki. We got a lot of Kawasaki answers. So it's eosinophilic. Do you guys know what eosinophilic granulomatosis with polyangiitis is standing for? What disorder is that really? That's the eponymous name for it. Do you guys know? They don't really call it that. Church Strauss, exactly. Yeah. So granulomatosis with polyangiitis is Wegener's, right? Yeah. So Church, exactly. So what system mediates consciousness, wakefulness, and attentiveness? Wakefulness and attentiveness. Exactly. Reticular. Yeah. So I always call it the reticular activation system. Yeah, reticular activation center. Yeah, reticular activation centers. I always call it because this had to do with wakefulness, waking up from sleep. So actually, if you have trouble in that area, you might have, be not locked in syndrome, which would have to do with central pontine, right? But you have problems where you're not able to move and you're actually conscious after a moment of, a period of sleep. So what is the cardiac tumor associated with tuberous sclerosis? Yeah, exactly. Rhabdomyoma. Sometimes they call it rhabdomyxoma. Yeah, it's the same thing, guys. So I don't know why they have 400 names for these things. That they use on the exam. They should just standardize it. But anti-cyclic citrullinated peptide antibody is specific for which condition? We know this. Yeah. So what kind of amyloidosis do you get from the answer to this question? If you want to get some brownie points for this question, uh, is it AA, AL, AB? Is it transthyretin, ATTR? What kind of amyloid? Yeah, this is a tricky one. So this is AA amyloidosis, but it's it's rheumatoid arthritis. It causes amyloidosis. What is the? It's not common, but it happens. What is the bony opening that serves as the exit for the third, fourth, and V1 and V2? So we said that the foraminal valley right here was V3. So you're saying, what is the opening? Rotundum, right? This is this rotund, right? This is the biggest one. It's rotund, right? But is that the answer? What do you guys think? It's the superior orbital fissure. So that's a fissure, right? So foramen's going to be something that's usually ovaloid, and this fissure is going to be, more kind of like a little slit in the front. The ophthalmic artery will actually go through a hole here that's not as easy to pick out. Yeah, yeah, yeah. I can only imagine you guys trying to say the word armadillo in a foreign language. I'm very impressed by you guys. Craniopharyngioma typically presents in which age group? Um, yeah, so we talked about this. It's supratentorial, right? This is one of the supratentorial. Infant. Yeah, 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 yeah. So you know, young adult. Actually, they're saying it's a little bit older. So let's look at that. Elderly, 50 to 75. Craniopharyngia in children that do occur and calcify. So it can be you can get certain yeah. So I was thinking children from step one, which they like to talk about because of the calcification on CT scan. But apparently the most common is 50 to 75. Papillary, and then you have adamantitis. Adam Mintimus. I cannot say that word to save my life while I'm nervous on camera. But we will move on. Craniopharyngioma typically presents in which age group? So it's actually young adults. So here we go. So visual information from the inferior retina travels to Meyer's loop. Do you guys know Meyer's loop? So this is all the visual as the light comes into your retina, travels down to the calcarine sulcus, so lateral genicular nucleus, to the Edinger-Westphal nucleus, the oculomotor nucleus, and things as it makes you blink your eye or constrict your pupil. What is the Meyer's loop going to do if you have a inferior retina travels to Meyer's loop before synapsing where? So we talked about it a little bit. It's the calcarine gyrus, right? No, it's the lingual gyrus. Okay, so let's look at it. I want to look at this. Meyer's loop. Oh, Meyer's loop is so this the pie in the sky is how I remember this because the quadrant that is lost. So the Meyer's loop here, you can actually click this image twice and it'll be increased in size. Yeah, so this is a really detailed question. There's the Meyer's loop, and I'm trying to remember the eponym for this loop. There's another eponym for this, but there's basically the left upper quadrant will be affected by the Myers loop, which is to say that when light hits the bottom right lower quadrant, um, the information will not be retained in the from there in the retina, because you're interpreting light as it comes in through the pinhole camera of your eye, and it's going to hit the opposite side. So if it's in the top left of your visual field, it's actually hitting the bottom right of your retina, right? Then it travels to your Myers loop, and because your Myers loop is not intact, you're not able to see the top left visual field. So this is actually your visual field guide. This is not your retina. So it's really good, important to think, what would happen if what would be activated by my retina? What part of my retina would be activated? And then as a result, which part of the visual field is not being interpreted? Because those are two separate questions. That's why this image has these light rays coming in through the pinpoint pupil of your eye. And then it shows the retinal areas that are being attached. This is red, it's coming down here. This is the Myers loop that they're talking about. Okay. So that's a very quick explanation with a very small image, but we'll talk about that later if you guys like. Visual information from the inferior retinal travels to the Myers loop. So, and then it goes to the lingual gyrus before the calcarine gyrus. So that's a very important detail actually, and that's a step one thing that I should know and I will review. Um, Thank you, Carol. I don't know. You know what? Anki. That's how. No, it's just it's American specific details that your institution's teaching you some great stuff, and there's too much for anyone to learn. So different countries learn different stuff, and that's really the answer. ABO hemolytic disease of the newborn presents with mild blank in the neonate within 24 hours of birth. ABO hemolytic disease of the newborn presents with mild, yeah, mild jaundice. It's now they're making a distinction between mild and severe because we have Rho. If you have a Rho positive child and a Rho negative mother, and it's the second child that they've had after they've been primed with a Rho positive child their first birth, they have blood mixing when the placenta detaches from the decidua, and you wind up getting a hemolytic disease that is not mild. That has to do with Rho incompatibility. That's why you give Rogam in the 32nd week, right? So, what skin symptom is associated with methemoglobinemia? Some people say methemoglobinemia. If you look up a picture of this, you'll never forget it because people look very different. Just say it that way. They look exactly, Cynthia. Yeah, they look like a Smurf but red. They look unbelievably red. Um, and red is also the answer. Cyanosis is also true. You can get familial methemoglobinemia, and you can get methemoglobinemia from um, things that you usually anesthetics that you take. But this is an interesting fact that your ABG um, will be 10% difference between your ABG and your actual like oximeter on your finger will suggest methemoglobinemia, and your oximeter on your finger will always say that you're at 80%, which is really low. And so when you're at 80% on your oximeter and you're 5% different, that's pathognomonic for methemoglobinemia. Yeah. So it's actually both, Samsung. Yeah. So you're going to get erythema. If you look up a picture of somebody with methemoglobinemia, you will never forget it. But another thing that can cause redness is cyanide poisoning. So you don't want to confuse the two just on the basis of being red. You want to think about other things as well. Most especially the things that had happened before that predispose you to either having methemoglobinemia or carbon monoxide poisoning, which would cause you to if you had like a heater that was old, like an old cabin, they have like a fire that's going for too long, or an old heater that's going on for too long, you can get carbon monoxide poisoning and turn red as well. Patients with subclavian steal syndrome present with vertebrobasilar insufficiency, dizziness, vertigo, and blank attacks. So what did we say? Dizziness, vertigo, and blank attacks. Drop attacks? Yeah. We can try. Drop attacks is kind of a weird way of saying. I think that might be just let's try drop, but I don't think it's drop. Yeah. Okay, so it's drop. So let's look at what they mean by drop because it's weird English. I think they chose that phrasing is a little bit strange in English, but drop attack is a sudden collapse without a loss of consciousness. So it's like, I guess drop attack is a sudden collapse without loss of consciousness. Syncope is where you lose your peripheral vision and then you lose your central vision. So you can definitely have like, yeah, I mean this would be a syncopal episode for sure. Um, that phrasing is interesting to me. Drop attack. So I'm learning here. This is like everything that's on the On King deck for RX. So absolutely drop attack. Which bacteria often causes subacute pelvic inflammatory disease and hence often goes undiagnosed? Pelvic inflammatory disease. Yeah, yeah, you guys are killing it. Okay, so Gano's a good answer as well. Um, Subacute though, they're saying subacute inflammatory. So D through K. Yeah, both can cause PID, Carol. Absolutely. Um, that's absolutely right. Which transfusion reaction um, presents with fever, hypotension, tachypnea, hemoglobinuria, and jaundice? Um, all right. So this is a blood transfusion. Hemoglobinuria is starred. So you guys know what trolley is? Trolley is like a transfusion reaction that causes you to have, shortness of breath. You have it's a transfusion reaction that is a lung injury, as opposed to allergic transfusion reaction would be like anaphylactic reaction. Acute hemolytic transfusion reaction is like ABO mismatch, right? And then febrile non-hemolytic transfusion reaction is when you have like blood products that have been hanging out in the transfused blood for too long before they are transfused, and you wind up getting a fever. Um, so AHTR. Let's try AHTR. I'll click on it first so it reacts. Okay, great, great. All right. So, what type of herniation may cause compression? We got 5 more minutes. We'll go, and then we'll talk afterwards. Whoever wants to stay and talk about science or talk about the software or talk about whatever, you can do that. Uncle, you're saying, what type of herniation may cause compression of cranial nerve 3, leading to ipsilateral dilated pupil with a down and out gaze? Uncle, right? Uncle herniation. So the location of that is very visual. So I'm going to show you what uncle means, just so we don't rapidly go from one thing to the next, because I love this image. Um, so you see how the uncus is this is the basilar artery, guys. So if you got a thrombus here, that's where it would be. So that's like very life threatening. So this is the PCA here, and the uncle herniation can cause problems with vision, as well as you can have what's called coning with uh, mass effect. So in Brown-Séquard syndrome, there's a lost pain temperature sensation on which side relative to the lesion. So this is spinal thalamic tract, right? So will the spinal thalamic tract decussate? It's basically what they're asking. Does it decussate after the transection of the spine? What do you guys think? It'll be contralateral, right? Contralateral. So where does it decussate? Does it decussate two levels below, right? Yeah, 2 levels below. So we'll look at that. These neural ones I like to stop and think and look at them, even though I'm sorting them for later. Because look how the spinal thalamic tract is 2 levels down. So you actually have two vertebral layers that are unaffected, and then you have spinal thalamic tract that will carry pain and temperature on the contralateral side. This black signifies the place where the transection of the spine will happen. This is often depicted as a someone got stabbed in their spine by a knife on the USMLE exam. Usually that's how they describe it. Um, What dermatome is found in the nipple? So this is the breast. Where's the nipple dermatome? So you think thoracic, it's going to be in the chest, but yeah, T. Yeah, so it's close. Is it T6 or T4? It is T4. Okay. What is the umbilicus? Do you guys know the umbilicus? The belly button, we call it in the States. It's T10. T10. Yeah, T2 would be higher up, right? Okay. So we got it. All right. All right. So which class of antibiotic is avoided in pregnancy due to causing cartilage damage? This is actually new. Yeah, Livia, you're yeah, nice. Because this is new. This is like the fluoroquinolones cause the tunica media of your vasculature to be the cartilage there to be and actually one of the considerations with fluoroquinolones is not just the cartilage, and usually this is the cartilage in your Achilles tendon that causes problems, but you can also get aortic aneurysms from the same mechanism in your vasculature, the tunica media. Um, Lesions to cranial nerve blank result in deviation of the uvula away from the side of the lesion. So you don't lick the lesion. Lick the lesion would be hypoglossal. Away from the lesion. Is it the Let's try the Vegas. That's Samsung. Let's try it. I can call out Samsung all day, so I'm gonna be like, Samsung said this. No big deal. Which herpes virus is associated with nasopharyngeal carcinoma? Um, but Samsung killed it. Everybody's getting everything right. So as which herpes virus is associated with nasopharyngeal carcinoma? Um, yeah, Epstein-Barr virus, herpes virus. Epstein-Barr virus is a herpes virus. CMV is a herpes virus. You guys just you already know that because you know everything. Herpes virus is associated with nasopharyngeal carcinoma. Epstein-Barr virus. All right, let's try it. Nice. The only axons that leave the cerebellar cortex are those of which type of cells? Purkinje. I think you're right. Try to type Purkinje quickly. I guarantee. Yeah, guaranteed typo is try to type Purkinje quickly. Okay, stellate. So stellate. Yeah. So we'll talk about cerebella a little bit later, but these are good answers. But Purkinje is a very impressive cell. I love the Robert and what is it, Cajal, the artist who does the Purkinje silver stain drawings. They're so good. Disseminated intravascular coagulation, which happens to the fibrinogen levels. Disseminated intravascular coagulopathy. What happens in the fibrinogen levels? Yeah, the answer was Purkinje, by the way. You got it right. Yeah. So fibrinogen will go down, I think. Yeah. Yeah. So you're losing fibrinogen. PTT will go up. PT will go up, but fibrinogen will go down. Cardiac rhabdomyoma is associated with which condition? So we got this already. You guys know this already. So yeah, yeah, we got it. So what demographic is more commonly? Oh, we'll wrap things up after this one. So which demographic? We got to get this right, guys. Which demographic is commonly associated with PSGN? Children. Children. We got children. Let's get. Yeah, we got three answers. Children. Nice. So how do you guys feel about the like software? Like, do you guys like this like format just to teach? I mean, to use for yourself, do you like it? And do you like it to teach? Maybe you only like it for one format. But I'm just curious if you guys like the session this way, if we should do real USMLE style questions on med bullets. Whatever you guys do, that's what we should. Do you love it? You like it a lot? Oh, cool, 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 cool. I like it too. It's way more fun for me to interact with you guys, and I think it's less pressure because we're going through so much stuff. Good, 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 good. Okay. Well, we'll do random questions next time we meet, and I love it because I learn too, you guys. I get some of these wrong, and I mean, they're great for everybody involved, I think. And what's great is ultimately we're hoping to do cahoots maybe, so we might even be able to score them later. But this software, would you want to use this software as well for studying? I'm just curious. Um, how do you guys feel about that? For sure. Okay. Cool. 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 Well, because I'll just show you one thing. I'll share my screen again and just show you one aspect of it that we've done throughout this, because um, as we've worked together on this deck together, we have done all of these Anki cards that are multiple choice, but we've also accumulated all these wrong answers. These are all questions that we answered incorrectly throughout our session that have accumulated on a deck that we could just go through them and they would be spaced repetition. So if we went through those, they would be spaced repetition. This is all functional. This is all working software right now. And if you go back to your Gator deck and you look at the tagged USMLE style questions, a lot of these are suspended. Why are they suspended? Unsuspended. Why are some of these unsuspended? Because we got them wrong. So if you got a question wrong, like we got the Epstein question wrong, that means that it's going to be unsuspended. So when we go to that deck, the only cards that we'll have to review will be cards that we got wrong. So those are especially important for us to see again, and they'll be spaced repetition. So if you guys like that, let me know. Oh, good, good. Okay. If you guys like the software, we'll keep building it up and making it better because you know, oh, good, good, good. Yeah, I like this idea because it can be fun, interactive. Ultimately, we would like to make it multiplayer so that people can even play together with multiple choice, and then their own decks will be changed in different ways, personalized to their own needs. So if they got a question wrong, their Anki cards would be changed one way. If somebody else gets it right, their Anki cards would change in another way. Exactly, exactly. So it could be really, I think it'd be really fun and really a quick way to get ready for the USMLE ultimately. So thank you guys so much for coming. I offer tutoring, direct tutoring as well. It's not done this way. We do real questions. Um, and if you'd like to contact Julia either by through WhatsApp using this number here, she'll put it in the comments. Um, and uh, and you can contact me directly in the WhatsApp group as well. I'm on there. So I'm so glad you guys liked it. I enjoy this. Well, next time we do a meeting, we'll do more of it. You'll see some of the progress we've made with the software. So, all right. So nice meeting you guys. See you next time.